Hey, welcome to my spinal stenosis series. In this series, I'm going to get straight to the point. I'm not going to waste your time. We're going to go all through spinal stenosis, all the details. We're going to talk about treatment options, talk about management, talk about long term outlook. I want you to feel comfortable understanding this condition inside and out by the end of this series. I'm going to answer questions that I've been getting for over 10 years from folks that. For some reason, these questions are just not answered in the clinics. I don't know why. We're going to cover them today. So stick around for this next video. What is spinal stenosis? At its core, spinal stenosis is a narrowing of the spaces that the nerves travel through. Okay, so there's two main types of spinal stenosis. There's central stenosis and there's foraminal stenosis or lateral stenosis. Central stenosis is when there's a narrowing of that central canal in your spine that the spinal cord passes down and the nerves pass through. Okay. And with central stenosis, you often get symptoms down both legs at the same time. Foraminal stenosis or lateral stenosis is a narrowing of that opening on the side of your spine where the nerve roots exit and then go down to your legs. So you can have foraminal stenosis on one side or both sides. So with foraminal stenosis, you're more likely to get symptoms down one leg versus both. You may get more symptoms down one leg versus the other. So that's basically how that works. A lot of people have a mixture of both central stenosis and lateral stenosis. That's just very common to have them at the same time to some degree. So, the reason this is a problem when these spaces get narrower is when nerves get compressed, the nerves are deprived of blood flow and oxygen. Nerves are just like any other tissues in the body, they need blood flow and oxygen to function. When the nerves get compressed, they're deprived of this blood flow and oxygen. And that's when you get the symptoms down your legs, the pain, the numbness, the tingling, the achiness, heaviness, weakness, impaired coordination. This is all because of the nerve getting compressed. And when the nerve is compressed, it can't send the signals properly to the muscles and everything falls apart. Okay, so that's spinal stenosis in a nutshell. So then what causes the spinal stenosis? Most cases of spinal stenosis can be traced back to degenerative disc, the disc degenerating. Okay, when that happens, it creates a cascade of events. So when the disc degenerates, that's our reality. It's part of our lives. The discs degenerate over time. When the discs degenerate, they get smaller. Okay. The vertebrae then get closer to each other. What that does is that narrows that space in the lateral foramen where the nerves exit, and it can compress those nerves. Okay. That can be how it starts. Additionally, as those discs degenerate, you might start getting one vertebrae sliding forward or backwards on another vertebrae called spondylosis. When that happens, that can create both central stenosis because the central canal gets narrower, and it can create lateral stenosis because that lateral foramen gets narrower. Okay, so when that happens, then you get more weight distribution on the facet joints, which are the little joints towards the back of your spine. When you have that, then the body starts developing bone spurs around those facet joints, and those bone spurs can take up some of the space that the nerves pass through, both in the lateral foramen and sometimes in the central canal. And then finally, as this process continues, the disc might actually herniate, in which case part of that herniated disc material can get into the central canal or the lateral foramen, and that can cause, again, both central stenosis and lateral stenosis. So there's a lot of different causes of spinal stenosis. Most of the time, it can be traced back to disc degeneration, and then that's why you get so many different presentations. You'll get somebody that has lateral stenosis at certain levels, and they have central stenosis at certain levels. You'll have mild degrees of stenosis and extreme degrees of stenosis. So it can be very complex with multiple factors, but at its core, it often comes back to disc degeneration. So, one thing most people don't realize is that most people over the age of 60 have some degree of stenosis. That's the nature of the game. Our spine, just like any other joint in the body, the spine wears down and you get smaller, narrower spaces to some degree. Okay. So, that's why you see it's not necessarily you have stenosis or you don't. There's degrees. It's a spectrum. You might have someone who has just a tiny bit of stenosis and they have no symptoms. You might have someone that has severe stenosis and they can't walk. Also, again, it varies from level to level. You might have mild stenosis at one level in your spine, and then you might have severe stenosis at another level. Additionally, for whatever reason, the MRI doesn't always correlate to the symptoms. I've seen folks that have severe stenosis. I had a lady today, I walked with her. She had severe stenosis. Somehow this lady is walking. I don't know how she's doing it, but she is. But if you look at her MRI, you would, without seeing her as a person, if you looked at her MRI, you would say, no way this lady's walking. And then I've had folks with mild stenosis. You look at the MRI, you say, okay, this shouldn't be a problem. And the pain that person has is excruciating. And so it really can vary. So much of it is the presentation, how that person is moving, what kind of symptoms they're having. The MRI can lead you in the right direction, but ultimately, the presentation is what's most important. Real quick, if you're looking for a little bit of hand holding and you want to take control of your low back pain, check out my free mini course in the show notes. I teach you 4 techniques you can start using right away. It's basically like a one-on-one session with me. It's free. All you have to do is put in your email address, check it out. I think it'll help you. So, the majority of people can get through their lives with stenosis without surgery. So, when does it become very serious? When someone starts having weakness in their legs, when they start losing coordination in their legs, when they start losing muscle mass in their legs, when they start having numbness that doesn't stop in their legs, when they start having falls, these are signs that the stenosis is severe and you can't just let that go on forever. If the nerves are getting compressed to the point where you're losing coordination, you're losing muscle mass, you're losing function of the muscles, that needs to be addressed, usually with surgery, because if you don't, it doesn't come back. It just gets worse and worse until you lose function. Um, with all the folks that I've seen over the years, when someone starts to have frequent falls, when they're walking and the legs just give out on them, no matter what, there's a limit to how many times you can fall before you're going to break a hip or hurt yourself. And so you can't just keep going that way if you're falling. And so those are some of the signs: the weakness, the loss of coordination, difficulty controlling the legs. Everything I'm talking about, I'm not talking about red flag. There are red flags such as loss of bowel and bladder function. There's a whole list of red flag signs that absolutely require surgery and quickly. So I'm just addressing non-emergency situations. But again, these are the severe cases. These are the rarity, not the norm. Is The norm is that most people have some degree of spinal stenosis and they can get through life without surgery. Okay, so you may be wondering then, what do all these treatments for spinal stenosis do? Let's go through a few of them quickly. Most treatments for spinal stenosis are actually about symptom management. Okay, most treatments for spinal stenosis do not reverse spinal stenosis, and that's okay once you realize what these treatments are actually doing. It's just important to know what's actually going on. Okay, for example, injections, steroid injections. Steroid injections for spinal stenosis can reduce inflammation around the nerves. And when you reduce that inflammation, that can relieve some of the symptoms going down your legs. That's wonderful. It's necessary. It can be a lifesaver. However, that injection does not change the structure of your spine, and it in no way reversed the spinal stenosis in your spine. That's okay, just as long as you realize that. Decompression or traction machines or whatever decompression or traction device, it can temporarily take pressure off the nerve. Blood flow and oxygen returns to the nerve. You get improvement in the symptoms down your leg temporarily. It feels wonderful. There's nothing wrong with that at all, as long as you know that it's not structurally changing anything in your spine. And once you leave the clinic or go do whatever, you're going to get compression on those nerves again. But you can get some short-term relief with that compression, with that decompression, and it can be worthwhile as long as you know it's not reversing your stenosis. Massage, dry needling, acupuncture. These things can relax the muscles that have tightened up because of the stenosis. They do not change the structure of your spine. Again, nothing wrong with these treatments. I'm in favor of them if they give you relief and they allow you to move more, as long as you know exactly what they're doing. Let's see here. Exercise. So obviously I'm a huge proponent of exercise for spinal stenosis. However, do not let anyone tell you that they have a list or that they have specific exercises that will reverse your spinal stenosis. That's not happening. The only way to reverse spinal stenosis is with surgery, or one case, if you have a large disc herniation and some of that herniated disc material has found its way into the central canal or the lateral foramen, and that herniated material is what's causing the stenosis, your body can actually resorb. It's called resorption. Your body can actually resorb that herniated material and basically get rid of it. And when that happens, that would clear the space and the stenosis would be resolved. That's the only case where the stenosis is going to be able to be reversed, truly reversed without surgery. Um, with that being said, even though the exercise doesn't reverse it, I've probably seen thousands of spinal stenosis patients now. The ones that are determined to keep exercising, keep walking, and keep moving are the ones that do better. The folks that give up, and I can understand this because of pain, because of frustration. So I can really understand that the folks that give up are the ones that really do struggle more, because once you stop moving, it just gets worse. So that's why the mindset shift is so important. Once you have that mindset shift that, okay, I have stenosis to some degree, this stenosis is not going anywhere without surgery. This is just what we're going to be dealing with in our life. Now you can focus on, what can I do to manage this? What can I do to maximize my quality of life? What can I do to minimize compression on the nerves? What can I do to keep moving the best way that I can? And this is going to be what you do for the rest of your life. You keep getting better at moving the right way. You keep getting better at recognizing what activities are making you worse. This mindset shift is a big step. It's step one, but it's a big step towards regaining your confidence with movement and your quality of life. So then, what actually helps with the stenosis? One of the keys is your movement strategies. Okay, you have to learn to move in a way that doesn't irritate the nerves. That's the key. We have to avoid nerve irritation. A classic sign of spinal stenosis is when you arch your back. For example, when you're standing for a prolonged period of time and you arch your back, that closes, or it narrows, that central canal, and it narrows that lateral foramen where the nerves pass out. That can cause compression on the nerves. That's when you get symptoms down the legs. What's happening there is those nerves are being deprived of blood flow and oxygen, like we talked about earlier. And so you're getting those symptoms down the leg. The longer those nerves are compressed, the longer it takes them to recover once the compression is removed. Okay. So if you're walking and you're getting the symptoms down your legs, it's so important to stop and sit down. When you stop and sit down, or when you stop and lean forward, it opens that central canal, it opens the lateral foramen, it gives those nerves room to breathe. And amazingly, those symptoms in your legs quickly disappear. Then you can get up and walk again. It's so important to stop when you're feeling these symptoms, because, again, the longer those nerves are compressed and you have those symptoms down the legs, the longer it takes for those nerves to recover once you relieve the compression. So learning, modifying your walking strategies, modifying your posture, modifying the way that you sleep. If you sleep in a position, lots of folks, when they sleep on their back, their low back arches, and you're getting compression on the nerves all night long, pain down the legs. That's you have to avoid that. So the way you walk, the way you move, the way you sit, the way you sleep, all these different strategies to learn how to move without irritating these nerves. When the nerve, when the nerves are compressed for a prolonged period of time, that's when you start to see the permanent numbness. That's when you start to see the muscle atrophy, the muscles getting smaller, the coordination issues, the weakness, the foot drop. Some folks, they get foot drop where you lose the ability to lift your foot and that foot starts smacking the ground. This is what happens with severe stenosis when those nerves are compressed for a prolonged period of time and they don't get a chance to breathe. So changing the way you move is not just for comfort, it is to prolong your use of these legs and not lose the ability to keep walking. Keep an eye out for the next video in this spinal stenosis series. I'm going to have, again, 4 to 5 more videos where I go in depth into certain aspects of spinal stenosis to help you understand the condition inside and out. I'm trying to go over things that folks have been asking me for years that are just not clearly communicated in clinics for whatever reason. And so check out my free mini course. That's a good starting point to help you move better in a way that protects your spine and minimizes your symptoms. Give me a thumbs up if this video helped you. Please reach out to me, message on the video, email me if you have any questions, and let me know if this video was helpful. I hope it was.